Good afternoon. I'm Amanda Slater, the Operations Assistant Deputy Director for the Department of Health and Human Services. Welcome to everyone for joining us on this call today. As most of you are aware, this is our quarterly provider meeting. We have representatives from multiple OUs within the Department of Health and Human Services. Some of them will provide a brief update. The others are available for questions, either related to the topics that they're presenting on, or if you have other questions for DHHS, feel free to just drop that in the Q&A section there. Just a few housekeeping reminders, as always, for those of you that want the closed captioning, there is that option available at the bottom of your screen. These readings will be recorded for any individuals that are not able to attend today, so they can watch it at a later time. Once they're recorded, they'll be uploaded to our YouTube channel, and we'll share that with everyone who was invited via the email on here. Again, at any time during the meeting, please enter your questions into the Q&A. We'll try to get to them during this meeting. However, if we're not able to get to them, we can answer them as a follow-up after this meeting. And additionally, you can submit your questions prior to this meeting at any time via our email address that will be dropped in the chat. So we're going to go ahead and shift over to our operational unit updates. And Shannon, you are on the docket first.
All right, thanks, Amanda, and thank everybody for joining us. I always look forward to our quarterly calls where we get to connect. I'm really pleased to let you know that CQI, Continuous Quality Improvement, will be conducting a listening tour throughout the state in March of 2024. The purpose is to hear input and feedback on our review tools and review processes for contract providers, find out where those pain points might be and what ideas you might have on how we can address those pain points. We will be doing this in person. We'll have sessions in Cache Valley, Weber Davis, Salt Lake City, Provo, Richfield, and the St. George Cedar City areas. Locations, dates, and times will be coming up very soon. We have hired 2 new quality management specialists. We're really excited because it's going to allow us to have more efficiency in the review process for you and to be able to provide more thorough services. We are also continuing to add additional tools to our online site. If we could get that site dropped into the chat, that would be great. If there are tools, templates, or supporting documents you think would be helpful to be there, please email us, and I think we're going to drop that email address also into the chat. We are continuing to work toward our pre-solicitation meeting. I know in our past conversations we had hoped to have it online by now, but we are getting close. Sometimes the wheels turn a little bit slower, but we'll be getting that online asynchronous training up very soon, and you'll be able to access and complete that at will. If, for instance, you are getting a different contract, maybe you're coming back after a while, stepping away from having the contract providing services, so that will be available. And if you know someone who's looking forward to getting a contract, you can let them know that as well. We are also progressing on developing a quality tool. I'm really excited about this one, for providers to use so that you can assess your own progression on evidence-based quality practices. When we have a draft, which we are very close to, we will be holding a meeting with providers for review and feedback. And we'll also have an opportunity to work through the tool with a small group of providers in order to pilot it and make those little tweaks that we always make when we are learning how something actually rolls out on the ground. And that is all that CQI has today.
Thank you, Shannon. We'll go ahead and turn it over. I'm not sure, Kevin, if DCFS has any updates.
No, good afternoon, everyone. No, at this point, we did not have anything specific that we wanted to share, but just want to be available for questions or comments.
Perfect, thank you. And I believe Rachel is here with JJYS. I don't see that you have any updates today, but just available for questions as well. Is that correct?
That is correct.
Okay, perfect. Thank you, Rachel and Kevin. And then I will go ahead and turn it over to Chanel.
Hi, thanks. I'm Chanel with the Office of Substance Use and Mental Health. I have two announcements for today. First, in one of the previous meetings that we had, we did notify everybody that Amanda Alkema had left our office, but we are excited to announce that Pam Bennett has taken her position or opening as our assistant director, and she'll be overseeing majority of our mental health services. And then the second one is that we do know and we're very aware that ASAM has made multiple changes with their new ASAM 4 that has come out. Our office provides lots of trainings throughout the year on ASAM criteria, and we will be providing additional trainings with the new changes coming up within the next year or so. We do foresee that this is going to be several years to make the changes as it affects Office of Licensing and Medicaid and so forth, but we will be providing provider trainings with the specific changes that are being made to the new ASAM criteria, just to make that announcement. And in the coming months, I'll make sure that I provide additional information on when those will take place. As of right now, with it being so new, none of the new criteria have been worked into any of the training so far. Okay, thank you.
Thank you, Chanel. I appreciate that. It looks like we don't have anyone from DSPD on at the moment, so I am going to come back to them. We do have Joseph Abernack with the Medicaid Long-Term Supports and Services on as well for questions. I don't believe he has any updates today, but is available for any questions. So I will go ahead and I will turn it over to the Division of Licensing and Background Checks. And I'm not sure, Carmen, if you're leading out or if it's one of your office directors.
I'll just say welcome. Glad you guys are here, and I will turn it over to Daphne.
Hello, everyone. Our big thing is we want to double check and make sure with all that anyone using DAX has their own DAX user account set up and is not sharing those accounts. If there are shared accounts, those will be disabled as we work with you to get each individual set up using their own user account. If you also need help setting up user accounts, please reach out to DHHS DAX at utah.gov, and we will put that in the chat as well. And I will turn it over to Simone.
Thank you, Daphne. Good afternoon. We're happy to announce that we have reorganized our teams in the Office of Licensing with the objective of providing better services to our providers to have more time to pay attention to their needs. And instead of two teams, we have one team for investigations, but the licensing teams were two teams under Dustin Penman and John Ortiz. Now we have added a new team, and it is under Amanda Lenti. And John Ortiz will be in charge of everything related to foster care. Dustin Penman will take care of everything related to congregate care. And Amanda Lenti will be in charge of everything, DSPD and everything else that the other two managers will not be taking over. So again, she's been trained, but she's very, very capable of helping these provider types, has a lot of experience, and is very willing to help. The second thing is that we will be soon implementing the same process that we do for DSPD and for child placement foster agencies in our system. So we'll be giving you more updates on the system to expedite the process of licensing these facilities, both child placement foster agencies and DSPD providers certifications. So you will receive more information soon. We're excited about it. Thank you.
Thank you, Simone and Daphne. We will go ahead and move over to Nathan Cruz.
Hi, I just wanted to let everybody know who, if you have the 91073 contract, the outpatient provider services contract, we do have currently a training opportunity open for registration for our trauma-focused cognitive behavioral therapy. This is in our vision to deliver more evidence-based practices and interventions across the state. It's currently available. We sent the notification to the individual who is listed as the point of contact on that 91073 contract. If you did not get that, or maybe that got to the wrong person in your office, feel free to reach out to me and cruz@utah.gov, and I can send that application your way. Just so you're aware, we've had tremendous interest in this. We already have double the amount of spaces we have, so it's going to be a very competitive process. But that helps us understand and know that there's really a high investment, I think, across the board for us to be delivering those evidence-based interventions to the children, youth, and families we serve, so that we can get people on the right track as quickly as possible and back to working in their homes, schools, and communities. So thank you for that. Again, questions around that, please feel free to reach out to me directly. And that's all I've got. Thank you.
Thank you, Nathan. I appreciate that. We are still waiting for one of our DSPD individuals to get elevated, but in true collaboration, I'm going to have Joe jump in and kind of do some DSPD updates while we're waiting for that individual. Like always, we all adapt and we cover for our colleagues. So thank you, Joe.
All right, so I'm doing DSPD's updates. Is that what you said?
Oh, sorry, Joseph. Sorry,
Oh,
not
that
Joe.
Joe. Okay,
Joseph,
we got
not
two
Joe.
Joes.
Sorry. Two Joes. My
You're
bad.
good.
Sorry.
Yeah, no worries. Yeah, I'm happy to pinch hit, and then really just going to share some of DSPD's notes that they left for today. Just some announcements or reminders. There are some fiscal 24 funds that are being used for a handful of projects that are available. One-time respite funding is continuing for individuals who are on the wait list. Eligible individuals can receive up to $10,000 to use for services that best meet their needs. There's also an ongoing long-term services and support study that is being completed with our partners at HSRI, the Human Services Research Institute. Funding for the study is coming both from our American Rescue Plan Act funding and some legislative appropriation. We're anticipating completion of that report by December 31st of 25, so a little ways out there. Funding was also provided to the Utah Parent Center to create some new financial management services training videos and to help families with onboarding to those services. This project started last fiscal year and will continue for as long as we have access to additional ARPA funds. Funding has also been approved to work with Dr. Builder from the U of U to create tools that families and providers can use to address individual psychiatric and behavioral health needs. That contract is still in process. It hasn't quite been completed yet. There is also a contract that is in the works for the Home and Community-Based Services rate study. It's passed initial review with procurement and contract management and is now with the Attorney General's office for review. As soon as that's completed, it will be open for proposals from prospective contractors. And then there are some additional staff that continue to be funded through that time-limited American Rescue Plan Act funding. The RFS committee has 2 individuals with family members on the waiting list who are helping with that community. That committee. A consultant with DTS is in the process of being hired to help make updates and improvements to the RFS process within USteps. And the contract team has hired a contract outreach specialist who is focusing on increasing services for respite and supported living. And additional staff that were hired last year continue to work with the wait list and the community transitions waiver. I think I covered anything, and I can see Bryn was also able to hop on. Not sure if there's any additional comments that you might have, or if that covers what you were hoping to share today.
Joseph, thanks for pinch hitting. Those are our updates today. Thanks.
Thank you. I appreciate that. All right, now I am going to go to Joe Doherty for some updates.
Thanks, Amanda. Well, welcome everybody. Just wanted to share a couple things from public affairs that have been going on in this department. One of the major initiatives that we do every couple of years is what we call the SHARP survey. And we have recently published the results of the SHARP survey, which goes to 6th, 8th, 10th, and 12th graders every other year. And it asks them a variety of questions about what they're observing at school, about their home life, about safety, about ask questions about whether they have access or use any illegal substances, gets a sense of how they are feeling as far as depression and self-harm and things like that as well. And I've posted the link here where you can see our most recent news release that includes some of the findings from the most recent SHARP survey that we got this year. And what we really quick, I'll just tell you, we do use the survey to educate parents about the harms of social media on youth, expand access to mental health services. We created the Parents Empowered campaign because of what we learned from SHARP, and we encourage parents to make the connections with their youth because we find that sometimes those connections are lacking, and we can encourage parents to do better. We developed the Safe UT mobile app because of SHARP, and lots of other things, and we continue to do that. Some of the things that we learned is that there's a strong relationship between screen time and the lack of sleep, thoughts of suicide, and substance use. We found that 38.4% of youth got 8 or more hours of sleep on an average school night. So just barely a third of our youth are getting enough sleep before school. And you can imagine, and as we all went through school ourselves, we know what that lack of sleep can do to all of us. So that's one example of some of the data that we get there. We found that 42.7% of youth who felt sad, hopeless, or suicidal didn't talk to anyone about it. And so this can help encourage us to find ways to help youth open up and help them understand that it's okay to get professional help if they need it. So that data has been published, and we're always happy to share it. It's really an important project that we continue to do every year or every other year in our department. The second thing that I wanted to share with you is that we have our state suicide prevention campaign called Live On, and Live On has done really tremendous work since its inception. One of the things that we know about suicide is that 91% of Utahns have been affected by suicide. And that means that 100% of us need to be ready to respond in the right moment and have the right training. And so we created the Live On Playbook with our Office of Substance Use and Mental Health. And the Live On Playbook is a series of Instagram posts, actually, that you can scroll through. There are 10 of them. And scrolling through these posts teaches you how to recognize the signs of suicide, helps you understand why someone might be considering that, and helps you understand what you might be able to say to help a person get the help that they need. It's really just that a lot of people don't know what to say, and this will help get people on that path. So recently, we have created the entire Live On Playbook in Spanish as well, and I've dropped a link in there. So if you go to Instagram and you search for Live On Utah, you'll find the English version of the playbook. And if you go to Instagram and search for Live On Latino, you will find the Spanish version of the playbook as well. The instructions are there and will really help give you, the people around you, some of those tools in order to respond appropriately if someone is contemplating one of those most terrible decisions. So thanks. That's it for me.
Thank you, Joe. I appreciate that. And exciting updates for the department. I'm excited to see the Live On Playbook available in Spanish. If you haven't taken an opportunity to do that, definitely do it. It's a really great, takes less than an hour of your time. And as Joe said, 100% of us should know how to react in those situations. So definitely worth looking at. All right, we are going to go ahead and transition to our Q&A section of this meeting. As always, we want to be responsive to our providers and any of the questions they have. You can ask our division representatives any of the questions that you have, whether they're related to today's updates or not. Just go ahead and drop them in the chat. And I am going to go ahead and put Simone on for the first question. We had an individual ask if there's a possibility for them to get the new org chart for the licensing teams.
Thank you, Amanda. I just wrote the answer on the chat as well. The new org chart will be posted by the end of the day on our division website. The division website is dlbc.utah.gov. So it will be posted by the end of today.
Thank
I'll
you.
drop the link there, but it is not posted right now. It will be posted by the end of the day.
Perfect. Thank you, Simone. Appreciate that. And yeah, if you can drop that link in the chat to everyone, that would be great. Next question, I believe, is for Nathan. Says, I love our terms and our acronyms. This is referring to a contract. 90743 is set to expire on June 30th. And I understand an RFI is coming out soon. We'll be making comments on the existing 90743 procurement language, or will the RFI be seeking comments on a new proposed procurement language DHHS has already drafted? There's a mouthful.
Yes, feedback from our providers is always one of the crucial components that we use to make our processes better and more effective. And we have multiple mechanisms to access that. We will, of course, announce any formalized processes for that as broadly as we possibly can to make sure that we get that out so that we do get the feedback we need to make things a win-win for everybody in these situations. So we'll look for multiple opportunities to do that.
Perfect. Thank you, Nathan. And I think that Shannon pinged me in the background. She might be able to add some additional comments to this. And thank you to the individual that put it's for the IDRC and the ABI DSPD. So there's 4 more acronyms for you all. But for the intellectual disability and related conditions for DSPD. Go ahead, Shannon, if you have additional insight.
Yes, thanks, Amanda. So yes, we will be sending out, or DSPD, we work with DSPD quite a bit, as you know, so, but DSPD will be sending out proposed language. There have been some tweaks that we have been requested to make just on, in response to best practices and ensuring that we are supporting providers in giving quality services to clients. So there will be proposed language that will be going out in the RFI for you all to have an opportunity to give feedback on.
Thank you, Shannon. I appreciate that. It looks like we don't have any other questions, so I will give it just a minute more to see if anyone else has any other questions for us today. While we're waiting for that, I will just open it up. If any of the panelists had anything they wanted to give updates on that forgot, feel free to jump in. All right.
Yeah, I'll take the opportunity for a little plug on behalf of Medicaid, if that's all right. Thanks. It has to do with just I guess more information surrounding the state's unwinding process. I think we've tried to share intermittently with different groups the state's work as we're leaving some of the facets of the public health emergency. Beginning in the spring of this year, Medicaid reviews restarted for the first time in several years. And of course, with processing several 100,000 reviews, DWS has been inundated with a lot of those requests. And apologies, threw in another new acronym, perhaps with the Department of Workforce Services there. They partner with completing those financial eligibility reviews, and just wanted to thank those on the call who have been assisting members and their families for completing those. With the waiver programs, we've seen the lowest turnover rates of just about all of the groups within Medicaid. Understanding there's about 10,000 members, that are in the waiver programs. Your help has been instrumental in making sure that continuity of coverage maintains and that individuals keep their eligibility. So a big thank you, and please continue watching mailboxes and email boxes for announcements of those reviews to make sure that we can keep coverage for as many folks that should be remaining eligible. Thank you.
Thank you, Joe. I appreciate that. All right, it looks like we've got another question, and I'm thinking probably DSPD, but I'm going to throw it out there and see who wants to bite on it. Are host home payments for host providers tax-free? If so, does the agency have to apply for a tax exempt, or how does that work for the agency?
This is Bryn with DSPD. Thanks for the question. We will gather some very specific details for you and send a response back out.
Thanks, Bryn. I appreciate that. All right. It looks like we don't have any other questions. In the effort of ending early, don't want to keep on here just to keep on here. We will go ahead and wrap up today's call. I wanted to thank everyone that joined us for your questions and any feedback that you have. At any time prior to these meetings, please feel free to submit questions to the email address that was shared with you. If we have those questions in advance, it does allow us to prepare if it's something that we may not have the answer to on the spot. So I just wanted to let you know that. Again, please look forward to the email for the next provider meeting. It will be on January 9th at 12 p.m. So we will see you all then. And in the meantime, I appreciate all you do to serve Utahns, to help DHHS meet our mission to ensure that all Utahns have fair and equitable opportunities to be healthy and safe. Have a wonderful rest of your day.